This is part one in a series of presentations developed to explain information standards and vital statistics. This first part is just an overview of all the standards and how they fit together to move information from hospitals to states and from states to the National Center for Health Statistics. We start at the data element definition level. Systems need to speak the same language. In healthcare, this is accomplished using controlled medical vocabularies, which are simply coded lists of terminologies in biomedical domains. Vocabulary has been developed for numerous biomedical domains, and many of them are incorporated into the vital statistics standards. For example, ICD-10 is an example of a controlled medical vocabulary that we're all familiar with. Some of the ones used in vital statistics standards include LOINC, logical identifiers, names, numbers, and codes, originally developed for the clinical laboratory domain, but now includes concepts such as 5-minute APGAR score, which has been assigned a code, among many other elements on the birth and death certificates. SNOMED, Systemized Nomenclature of Medicine Clinical Terms, a comprehensive, large, international in scope, coded index of clinical terminologies. Here are two concepts related to augmentation and stimulation of labor on the birth certificate. RX norm is an index of medications in the United States. We can see here just a couple of medications, antibiotics, that may be administered to mothers during labor and delivery. There are many other code sets, such as FIPS, that we're all familiar with. GNIS, a newer version of FIPS for geographic places, and CDC FIN value sets. FIN stands for Public Health Information Network, assigning codes to many concepts that aren't elsewhere coded. Those vocabulary terms are combined together into content exchange standards, such as HL7 standards. Sets of data elements are defined to be sent together for specific situations, such as admitting a patient to the hospital, immunizing a newborn, or registering a birth certificate. HL7 stands for Health Level 7 International, a nonprofit volunteer organization that develops standards for healthcare information exchange. There are three basic types of HL7 standards. The first is a CDA document, an XML-based text file that is both human and machine readable. There is also an HL7 message known as a version 2.x message, a pipe-delimited textual message. Finally, FHIR, Fast Healthcare Interoperability Resources, are a relatively new standard where fast means fast to implement because they use many common technologies used on the internet today. Combine those HL7 standards into workflows, and we have integrating the healthcare enterprise integration profiles. IHE is another nonprofit. They develop integration profiles, which are descriptions of complex information exchanges in healthcare that incorporate HL7 and other types of standards. A couple developed for vital statistics include BFDRE for birth certificates and VRDR for death certificates. To recap, data element definitions in coded medical vocabularies are combined to create content and exchange standards by HL7. Those exchange standards are incorporated into complex workflows for different scenarios in healthcare that are developed by IHE, integrating the healthcare enterprise. A couple of questions. Which organization develops content and exchange standards? Content and exchange are HL7. Which organization develops standards for high-level workflows? Integrating the healthcare enterprise develops high-level workflow exchange scenarios. And finally, name two controlled medical vocabularies. Answers may include LOINC, SNOMED, RX norm, FIPS, CDC FIN, or possibly others. And that concludes part one.